Welcome back. In this last section of the discussion about theories, I'd like to take a step back and consider the big picture. In this talk, we've been focusing mostly on individual behaviors, that is, how individuals choose to prevent malaria or seek treatment when they fall sick. But it's important to realize that programs may need to consider other factors beyond the individual. A lot of communication occurs within service delivery systems, between clients or between patients and physicians, or health outreach workers and individuals in the community. Other communication might occur at the political or the policy environment level. For example, media advocacy or the communication of health policies to health workers and health systems. In other words, there may be a story to tell at those levels too. How do things happening at those upper levels affect the stories at the level of the community and the individual? This Pathways to a Health Competent Society is one of those larger, big-picture models that describes how communication can help to improve communication and health services and communities in order to support the behavior of individuals. It's beyond the scope of this lecture to describe this model in great detail, but I wanted you to understand that the individual behavior theories do fit into a larger explanation of health and society. This Pathways framework brings together individual theories of behavior, including the four main ones we discussed, as well as theories at the service and policy level. Can you find some of these core concepts in the larger model of health communication in society? Look in the middle in the column that's labeled Health Competence Facilitators. Do you see social norms? Do you see efficacy? Do you see collective efficacy? How about at the bottom in the individual level of health competence facilitators? Do you see emotion, beliefs and attitudes, perceived risk, self-efficacy? These are some of the concepts we've been discussing in our lecture today. But the framework doesn't tell a single story of individual or even of community level behavior. This is something like a Chinese restaurant menu. Everything is there that you could possibly want to eat, but if you try to eat everything, you'll probably make yourself sick. Instead, use a model like this as a checklist or a set of building blocks as you begin to choose which story to tell for a particular program. Research can help you figure out which of the concepts and which parts of this model are relevant for a given setting or for a particular audience or a particular program. The underlying conditions on the left are your starting point. The sustainable health outcomes on the right are your destination. Which path or story is the best way to get from the starting point to the destination? Now, this is a generic pathways framework that we developed some years ago for a broad integrated family health program. But the next slide shows one developed specifically for malaria. Here, you can see that some of the factors in a general model still appear: emotion and values, beliefs and attitudes, leadership, networks, and so on. But there are some unique pieces of the story that apply specifically to malaria if the program goal is to reduce the burden of malaria by 80% or some target by the end of 2013. Can you find some of those unique elements related to malaria? Look in the domains of communication column, for example. Here you find something like the availability of insecticide-treated bed nets and treatment packages in service delivery systems. Look in the behavioral outcomes column. Here you see things like IPT1 and IPT2 adherence. These are aspects of successful service performance. How about in the lowest level of community and individual behaviors? Here you see things like leaders advocating for malaria prevention. Here you see things like adherence to treatment and pregnant women attending antenatal visits where they learn more about malaria. So you can see that a larger model like this can be used to see the role of individual communication in the larger picture of health improvement, and can help you to identify the right story to tell in getting your audience from the underlying conditions or their starting point to the sustainable health outcomes that your program desires. Let's stop here with our discussion of theories and frameworks for behavior change communication. This has been a lot of detail, a lot of things to absorb and to think about for your programs. It can take people years to fully understand the research and the theory behind some of these ideas, but we give you this introduction to get you started thinking about practical ways to apply some of these theories to the work that you do from day to day. In the last section of this lecture, we're going to give you a little practice at doing this. And we're going to show you a video and ask you to identify some of the theories that appear in a particular malaria message. So let's take a short break and then come back and look at the video.